Hi, I'm Peter Kaldes with another episode of Future Proof. Today we are here with Dr. Katherine Shear. She's the founder and director of the Center for Complicated Grief and is an internist and psychiatrist who's been treating people with complicated grief for more than 30 years. The Center for Complicated Grief does research to help the public understand complicated grief and offers comprehensive training and evidence-based treatment for complicated grief for professionals, social workers, clinical psychologists, and mental health counselors. Dr. Katherine Shear, welcome to Future Proof.
Thanks so much, Peter. Great to be here.
So today I want to talk about how families and friends might connect across the holidays while still enduring a pretty strict level of social isolation and separation as a result of the pandemic. And then we can talk a little bit about how people might be dealing with grief, particularly from the tremendous losses that they may be experiencing. Mm-hmm. So first off, I'm curious to understand how you define complicated grief and how it differs from other types of grief.
Sure, that's a great question, because actually all grief is complicated, and that's probably part of where that came from. And it is really all complicated because each time we grieve, we're grieving for a specific person or sometimes something else that was lost. And so what we grieve, the way we grieve is going to be very specific to that love relationship that we lose. And so that's part of why it's complicated. And it's also complicated because we like to say grief is the form love takes when someone we love dies. And what that really means is that it sort of contains all the various things that person meant to us. And so that's going to be complicated and also different for different people. And then on top of all that, it's of course highly stressful. So part of what we're going to be experiencing as grief is our response to the loss, and also sort of how we're coping with it and how we're adapting to the grief to the loss rather over time. So, and so grief is very messy, and it's not one thing. It changes over time, even for each individual grief episode. So what happens with complicated grief? That was really what we call complicated grief is really your question. And the answer to that is that one of the messy things about grief is that it naturally has a lot of kind of mixed feelings and sort of confusing thoughts. Like, for example, most of the time we want grief to be over, but we also kind of want to hold on to it. And there's a lot of mental pain, which we also want to go away, but we almost welcome it. We want to go on with our lives. We definitely want to go on with our lives, but at the same time, we have little enthusiasm for doing that. And sometimes even we feel weird, we feel uncomfortable going on with our lives when this person isn't here. That's called what we call survivor guilt, which can play a big role in how we're experiencing grief. So when one of those kinds of things kind of gets a foothold, it kind of takes over our lives, and we start focusing a lot on how this loss, another thing we do is we say if only something or other had happened. We invent alternative scenarios in which the person didn't die, and so we can get very caught up in that. And another thing we do is we want to we want to feel connected to the person who's gone, but at the same time, feeling any connection to them can make it even more painful that they're gone. So that's another kind of back and forth, and the avoidance that we sometimes land on to cope with the feelings of grief in the beginning can also get in the way of us moving forward really in a meaningful way in our own lives. And when any of these things happen, what you see is that the initial grief reaction, which tends to be very intense, acute, very preoccupying, it kind of gets stuck. And that, along with these kinds of elements of grief that are more kind of confusing and mixed, that's what we call complicated grief. So it's essentially a kind of grief that persists in a very, very strong or intense way and impairing way. It gets in the way of our functioning in our lives. It's sort of everything.
And
That's
I
complicated grief.
suspect as a result of those differences, there must be different forms of therapy for complicated grief versus perhaps regular grief.
Exactly. So regular grief, the biggest thing we need is we don't grieve well alone. So we need people, we need at least someone who is really can really be there for us. And that's one of the big things we need. And we need some time, and we need to be able to kind of cope with um, the various challenges that come our way, because the other thing, of course, that happens with grief is that it doesn't only amount to losing that person in your life, which is big enough change, but all kinds of other changes typically go along with that. And so we have to kind of cope. And so regular grief therapy is really oriented towards helping people cope. But if these, if you have complicated grief, that just isn't enough. So yes, you need you need something more. And that's where we kind of got started.
So let's talk a little bit about your practice, particularly now during the pandemic. What have you been seeing?
Well, I don't actually what you said in the introduction was about 99% true, but I don't practice right now. I run the Center for Complicated Grief, which is primarily what the reason we started it is because we developed and tested in pretty rigorous research studies involving a total of over 600 um, bereaved participants with complicated grief. A short-term 16-session therapy, which we call complicated grief therapy. And so the center is really about teaching people how to do this and reaching out to the clinical public as well as the lay public to just inform people about what complicated grief is, and and ways that it can be helped. So I
What has
yeah,
there been an uptick, perhaps, in the resources that you've seen being used as a result of the pandemic or during the pandemic?
very much so. And I will say, although I haven't been working with people directly myself, I have continued to supervise, which I do a lot of, and also we have people contacting the Center for Complicated Grief, where and we do talk with them and work with them. So, and yes, there's been an uptick in the request for a marked uptick in the requests for information from us, for talks by us, for workshops that we do. We've been doing all over the world, really, and clearly, this is something that we are seeing with the pandemic.
Can we get a little more detailed? I'm curious to learn about, healthcare professionals who are on the front lines and others who are
Right.
really in the trenches of this pandemic. What are the kinds of things that they're experiencing?
Well, I think the healthcare practitioners are really, really struggling. I think especially, I mean, they're struggling because they're over, as we know, they're overworked. They're they're working now in a highly, highly stressful environment, whether they're in the direct care of people who are having severe COVID symptoms, or whether they're trying to treat people in a more usual way in the context of COVID. Either way, it's much more stressful than usual. So they have a high workload often. They're in, of course, a high risk situation. They're putting themselves and sadly also their families and sometimes their friends at risk as well. And then to try to mitigate that, they're often being separated from their families when they are working in, especially when they're working in an emergency room where there's active COVID cases being treated. And that's really, really, really stressful. And then on top of that, there's another thing that's really, really hard for healthcare professionals is that this is a new illness. And what that means, as we all know, is that we don't have the best possible ways to treat it yet. I mean, it's getting much better. I think it really is getting better. But, especially depends on where you are. I think in the beginning, that was highly stressful and caused something that I don't know if you've heard of it. It's called moral injury, but that's
Mm.
something we've been seeing. a lot.
Can
Yeah.
you describe moral injury to our listeners?
Yeah, um, it's a condition that occurs when anybody is in a situation where they're either, in a sense, forced to do something or not able to stop something that's being done that goes against their sort of deepest held values, their sort of core values. So what we're talking here in this case is, for example, not being able to treat people that they would be able to help. Let's say that this is one of the things that the healthcare professionals had to deal with in some of the height of the illness, and maybe in some of the places where that's going on now. Of course, I'm in New York. That happened very dramatically last spring, and so they their job is to help people that they know how to help, and they were being redeployed to the emergency rooms, or they were not being able to see people in their offices or even in the hospital sometimes because that it was too dangerous for them to be in close proximity, and so they can't do what they what they really feel they need to do, and then on top of that they're being asked to do things like, for example, decide which person is going to go on a respirator when there were too few respirators, um, putting themselves in there and maybe other patients at risk when they didn't have enough um, protection gear, that sort of thing. So that causes a kind of what's called moral injury because you have to do something which is going against your value system.
Speaking of value system, I'm wondering if you could share a little bit about how grief during the pandemic has been experienced differently amongst different cultures, amongst different races. At the ASA this year, we're really hyper focused on equity and equitable access to healthcare, including mental health. So I'm wondering if you could share any experiences that you might be seeing in the field.
Well, absolutely. I mean, I think we actually are working with several of the churches in Harlem, in New York City, the Black churches in Harlem, where I've heard stories from them of just horrific stories of multiple people in the family and neighborhood being affected by COVID and then actually dying. Some of the stories of people who've died in those communities are just totally heartbreaking. And also through that, and of course, the Black Lives Matter movement that has of course um, been very central in all of our minds. And just the disparities and the inequities that exist in our country right now are pretty breathtaking.
No,
And they,
absolutely.
yeah,
Absolutely. I
yeah.
completely agree with you. And I'm wondering, can we talk a little bit about innovations? Right now, as a result of the pandemic, telehealth has exploded. It's
Hmm.
been a wonderful resource for those who have access to it. For others who don't, it's not a resource. But for those who do have access to resources like telehealth, can you talk us through how people have been dealing with grief or coping with grief or seeking treatment for their grief through telehealth?
Sure. I mean, in a way, Peter, the short answer is yes. I mean, I think there's a lot of that going on, and a lot of it I do think is very beneficial. In fact, and so people are seeking. There are good support groups, and there are various ways to get support on the internet. A lot of really good ways to get support on the internet, and people are taking advantage of that. And in terms of actual grief therapy and other kinds of mental health therapy, that's also going on. That's been a little bit more, I think, a little bit more of a sort of um, slower start because of the practitioners are not all comfortable with it. I think, and neither some of the clients or the patients aren't either. Maybe especially older people are less comfortable. But as we've gone on, I think people are becoming more and more comfortable with it and finding those ways to connect that they originally haven't had. But I do think that we're all we're all a little ambivalent about the digital world, and and so that's kind of a part of what we're dealing with. In a way, it is absolutely our best hope in this situation, but it does have its sort of dark side. It has the frustrations. It can be very exhausting, as I'm sure you know, to spend all day long on on a video meeting.
It
Yeah.
can be absolutely. Uh, One of the topics I wanted to talk to you about was the fact that we're in the midst of the holiday season
Mm,
and social isolation is just exacerbated during this time, particularly with the pandemic.
right.
What tips would you have for our ASA members who are professionals in the field in finding solutions or perhaps resources that could assist the older adults they serve and sort of help reduce some of that social isolation?
Right. So, I wish I had really good answers to that, but I will say that I'm a firm believer in, in sort of two things. One is that we do have to, kind of like the serenity prayer, we have to figure out what we can do something about, and do our best to do it, and then kind of accept where we are, and try not to be you know too much tilting at windmills. So and then figuring out which is which. What can we actually do something about? That's one thing. And the other is that there's there's lots and lots of evidence that people are enormously resilient. I think therapists are resilient, and older people are resilient. It's possible if we work together, and we have to just make up our minds to do that. And so I don't have exactly specific. I'll tell you one thing that I've thought of in this regard, but I think mostly people have to stay with it, and not give up. And yes, and accept the fact there are going to be frustrations. This is not business as usual. There are so many stressors. I sometimes think of this as like, when you have your computer on and you have, I don't know if you do this, but I have, like, sometimes I have as many as 50 or 75 programs running in the background, and then it doesn't run so well. It's like we have all this background stuff that we're having to deal with. Everyone is having to deal with these days. And so we're not going to be quite as, you know, energetic and as all there as usual. And if we accept that, and then kind of try to move forward in the ways that we can, I think we do have a lot of things we can do. So one thing I was going to say is the one thing I would say is that in the process of helping people, one of the things, there are a couple of things that can be really, really important for grieving people. One of them is to basically learn to get to know their grief and accept it. Remember, I said a few minutes ago that grief is the form love takes, and it really is that. And and so you can get to a place where, yes, it's painful. We're sort of pain aversive in our society. I mean, it's natural to be pain aversive, but we're overly pain aversive, and we're pain aversive in other people, and we want to just make it all go away. But we don't have to make it go away. We can sort of honor it and let it be painful. It's not going to stay only painful. And so that's sort of a piece of it. And you can do that by paying attention to your grief, and sort of learning what's in your grief. Professionals can help people monitor their grief, and sort of learn to understand it, and in the process give them some skills for regulating their emotions. And part of that is to try every day to make almost a ritual of some kind of activity, simple activity, that's either as relaxing as you can be right now, or as pleasurable as they can be. And sometimes that's just a little bit of pleasure or a little bit of relaxation. But even still, building that into the day every day can help everything on a little bit. So
Those are
that's
fantastic tips and resources, not just for those who have suffered losses or are dealing with complicated grief. But I can tell you, as I think about our ASA members, many of whom are on the front lines, like we talked about earlier, those are very useful tips. So thank you for that. So I'm wondering if you could also share a little bit about the center's research and the work that you're doing.
sure. So we're really very proud of the research that we've done. We actually did it about a decade, about 10 to 20 years ago now, and that was to develop and rigorously test a 16 session intervention for a therapy, really, a talk therapy for people who are struggling with complicated grief. And the we found that this was highly effective. It's one of the more effective psychotherapies that we've tested in this kind of way. And we did a specific study. This is also unusual. We did do a specific study just for older adults. We had a group of 151 people in that study, who all of whom were over 60, I think, and the mean age was 66. Some of them were into their 90s, and they had just as strong a response to the treatment as younger people did. So I think it's something that we really want therapists to know about, and we want people in the community to know about, because it can just really what we've seen is that it can really change a person's life if they're very much stuck in that, in that sort of what seems like endless grieving, after which can go on for years and years after someone died, and really bring a person's life to a standstill. And we do have a method that is successful in kind of helping them find their way out of that.
Terrific. Looking to the future, I'm curious if you could share some thoughts on some innovations perhaps in grief therapy. What are you seeing that you're excited about? Are there new trends that perhaps you could share with us?
Well, I think there are a number of new trends. One of them is actually to work on various ways to combine the digital um, information and even interaction, in interventions themselves. That's what we're actually working on with the churches in Harlem, is finding ways to build together with. We don't want that to totally replace people, but to be sort of a helpful adjunct. I think there's a lot of potential there. So that's one thing. And by the way, I think older people, oddly enough, if you can get yourself, if you're an older person and you can get yourself to connect with the digital world, it is like magic, I think, because to be able to be connected to the people that we love, or even to new information, or be able to connect to a movie at any time of the day you want to watch it, or to play a game of Scrabble, whatever it might be. It's like magic, and I think it's much less sort of problematic for older people, honestly, than it is for younger ones. I worry about the children. I'm very worried about children, and the internet being too much a part of their lives. But for older people like us, like me, and like the people we're talking about and talking to right now, it's more of it's really kind of a wonder. And so that's one exciting trend. Another
Yeah,
one, yeah.
no, that's wonderful, and I would just have to echo your sentiment and your encouragement for folks to think about how technology can be deployed, whether it's for providing services or in basic social connectivity, launching a FaceTime app on a phone and having a conversation with a neighbor or a grandchild. I think you're absolutely right to be encouraging that. And what was your second innovation?
So then the other another innovation is really personalizing therapies, studying much more about personalized therapies, a lot more building in mindfulness also to therapies. That's happening kind of across the board, but that's something that can be so helpful to people. And then the last one I'm a little bit hesitating to mention, but I do think it's very interesting, and that is the whole issue of psychedelic drugs, which when used, they have to be, they're still under study, but there are some very promising results with that. And I think, again, for a person who's in an older person who's thinking about the meaning of life a lot, and I think, and sort of getting their lives in order, I think there's a huge amount of promise in using that as a, again, as a kind of adjunct to therapy. But with a good therapist in the right setting, it seems like there's a lot of promise in that.
That's really interesting. That is an interesting observation about some of the stigma related to such drugs being deployed. But I think you're absolutely right. We should be sort of looking at all options seem to be on the table, particularly during the tough holiday season when so many people are dealing with grief and loss and candidly grief from sort of Christmases past, if you will, or holidays past, because
Yeah.
now we're in the midst of a pandemic and it's just a very different type of holiday season. Uh, but thank you, Dr. Shear, and absolutely thank you for participating in Future Proof today.
Well, it's a pleasure, and thank you for having me.